Fergus, could you give advice to people who aren't getting the vaccine at the moment, if they're in a situation where they're in contact with people who perhaps might be vulnerable, whether or not they've had the vaccine? So we're talking about relationships like the employer and their PA. What guidelines are there for what they can do if they're not getting the vaccine at the moment? What is the best way to be cautious?
So I think it's the same infection prevention control approach that we would take if we were looking after patients in hospital. So if you're indoors, it's really helpful if you both are wearing a face covering. I think you minimize the duration of time indoors. That's got to be balanced with the care and the support that you're receiving. It's difficult at this time of the year, but ventilation is an important thing about changing the air in a room, having a window open, having a little bit of fresh air into the room. It'll be easier as we get into the summer because we can have the windows open and the like. But wearing a face covering, minimizing the amount of time in contact with each other other than for what's necessary. Some ventilation in the room, they would be probably my top three. I think keeping distance, because sometimes the support can be, you can talk about what it is that you're doing and how you're providing help. So maintaining a bit of distance is helpful too. And of course, washing your hands, as I've mentioned. It's such a silly thing. And I know Boris, when he was singing Happy Birthday and rolling up his sleeves, and people were sort of tittering a bit about it, but it's one of the most fundamental aspects about how to reduce cross-contamination, making sure your hands are really clean. They're my top tips.